Hi, my name is Brittany Robertson. Today I'll be comparing outpatient care systems between the United States and the United Kingdom. Some of you may be wondering, what is outpatient care? Outpatient care is also called ambulatory care, but for this presentation, I will be sticking with outpatient care. And it is comprised of health consultations, primary care services, procedures, medical treatments, diagnostics, and other healthcare services that do not require a patient to spend the night at a hospital or medical facility. Prior to outpatient care, physicians would normally visit their patients at their homes, or they'll be accessible at a clinic. Due to medical advancements and economical benefits, outpatient care facilities have become more popular and accessible for patients. Now I will go over some examples of outpatient care settings and services. For settings, we have private practice, hospitals, outpatient care clinics, mobile facilities, telephone triage, home care, hospice. We have community health centers and free clinics, also alternative medicine clinics, and then some services that you can receive in some of those settings are routine examinations, blood draws, urine analysis, x-rays, MRIs, and ultrasounds, breast exams, and mammograms, colonoscopies, chemotherapy and radiation, also chiropractic services, just to name a few. Now I will explain the importance of outpatient care. Outpatient care is not only important for patients, but it's also important for medical facilities. First, outpatient care provides patients with an effective option for medical care and treatments compared to inpatient services. Patients are able to recover in their own homes compared to having to spend a night in the hospital. And being able to recover in your own home, you may be able to have support from your family. And then there's a sense of familiarity by being in your own home. And then if you have to spend the night in the hospital, there's extra charges with spending a night in the hospital. And then outpatient care treatment also allows for quick discharge, and it allows medical facilities to capitalize on reimbursements and create a substantial market for outpatient care and treatment. And this is a growing trend and will be continued as the way that medical facilities conduct business. Now I will go over key features of the outpatient care system in the United States. First, we have accessibility. Outpatient services are relatively accessible for individuals who live in metropolitan areas. About 93% of office visits were from individuals living in a metropolitan area. And then for primary care gatekeeping, outpatient care acts as a primary point of entry for patients seeking medical attention. It's serving as a gateway for further specialized care if necessary. Gatekeeping also protects patients from unnecessary procedures and overtreatment. And then we have reduced hospitalization. Outpatient services prevent unnecessary hospitalization and reduce healthcare costs for patients. Most surgeries are conducted in outpatient settings and are expected to continue to be performed in outpatient settings, as I mentioned earlier. Also, children who receive preventative care from primary care providers are less likely to experience hospitalization. Just to continue with key features of outpatient care systems in the United States. Next, we have cost effective compared to inpatient care services. Outpatient care services tends to be more cost effective for a patient. And research has shown geographically if there are a high amount of primary care providers compared to the population, the population tends to have a lower healthcare cost associated with them. And then last, we have technological advancements. New technology allows surgical procedures to be performed in outpatient settings, and these procedures are performed with short-acting anesthetics, and the recovery time has reduced. So that's really good for the patient overall. And then we have rapid advancements in telemedicine and remote monitoring technology, which offers opportunities to expand access to outpatient care services, and it enhances patient convenience. Okay, now I will discuss the challenges facing outpatient care in the United States. Healthcare disparities. Yes, I did previously mention that accessibility to healthcare in metropolitan areas was pretty high, but it's not shared across all communities and populations in the U.S. So disparities in accessibility to outpatient care does exist, and this has been identified as impacting individuals who live in rural communities, who are uninsured, or who may be a part of a minority group. And this can lead to unequal health outcomes for these groups. Another challenge is overcoming wait times. Wait times for in-office visits are typically associated with long periods of waiting. Patients will spend more time waiting than they do seeing and speaking with their provider. Also, another challenge is coverage for alternative healthcare. There is a growing interest for alternative forms of healthcare, but oftentimes these forms of healthcare are not covered by insurance, which is doing the patient a disservice because they're not able to access healthcare services that may be beneficial to their illness or diagnosis. Okay, so now I will discuss key features of outpatient care systems in the UK. First, we have National Health Service. The outpatient care system in the UK is primarily funded by the National Health Service, which provides free healthcare to all citizens. And then we have primary care gatekeepers. There are two entry points to receiving primary health care in the UK. First is general practice, and this provides care for acute illnesses, terminal illnesses, injuries, and it also helps patients manage their chronic diseases. General practice also is expected to provide services for health screenings, pediatrics, vaccination, sexual health, and maternal health. And there is a fine associated, not a fine, but the government withholds their the health facilities reimbursements if those type of services that I just listed are not provided, or the care facility denies providing those services. And then the second form of primary care, healthcare is the primary medical service, which is led by nurses, or it could be led by other primary healthcare professionals. And then we have plan strategies. So in the UK, they have a 5-year plan of initiatives to decrease the workforce shortage in primary care. They noticed over a period of time that people have not been going to school for primary care, or even to become a physician and specialize. So they're trying to reverse that shortage. And then there's a 10-year plan to improve population health by implementing a national plan to address cardiovascular disease, respiratory disease, cancer, and mental illness. Okay, finally, I will discuss challenges facing outpatient care in the UK. As I mentioned prior, there is a workforce shortage in the UK. There are fewer and fewer people going to school to obtain a medical degree, and the workforce shortage is just continuing to grow. But the government in the UK, they're hoping to increase their primary care providers and specialists over time. Hopefully through their 5-year plan and implementing their proposed initiatives, they are able to grow their workforce of primary care physicians and specialists. And then another issue that they're facing is their aging population. The aging population is growing, and it's placing a huge burden on the healthcare in the UK. They also have identified that a large portion of out-of-pocket costs are contributed to the long-term care services and home health care services that are provided. And those services are associated with the Asian population. And then another challenge that they have to overcome is the healthcare budget. In the UK, the government is challenged with reducing the healthcare costs, but the deficit among the foundational trusts that continues to accumulate. The deficit basically continues to accumulate, and there is a need for reform to create new government systems to address the economic burden of the healthcare costs. That's the end of my presentation, and I hope you were able to learn a little bit about outpatient care in the US and outpatient care in the UK. Thank you.